We're kind of amused. There's one center in particular that keeps claiming that or insinuating maybe our patients are getting gaps with the restoration. When we did 2 years of extensive R&D, we actually did 1 full year before we even saw a patient. Because of our proprietary suturing technique, surgical technique, and how we designed the surface of our zirconia to adapt to the healing tissue. Now, 7 years later, with thousands of arches done in multiple cities, about 95% of the time, if you look, when the tissue is healed, we have perfect adaptation with no gaps. About 5% of our patients, when we're totally healed at about 4 months when we look, we have slight, maybe 1 or 2 millimeter gaps. So what we do is very simple correction. We take the permanent custom zirconia restoration off one morning, preferably when you're coming in for your first cleaning. We insert your custom interim teeth that you only had to wear about five days before getting permanent teeth, not 10 months with temporaries. And then we send it to our laboratory, and then what we do is we add real porcelain to the undersurface, and then that goes in a furnace, and under high heat, the porcelain becomes molten and becomes an integral part of your zirconia restoration, and that will usually go for the next 20 or 30 years because the tissue doesn't shrink. So we're very proud with the R&D we did that our patients, and we guarantee you this, at the end of the healing, we will never let a patient have a gap. But with D5 technology, instead of going to a center that only has the ability to do inexpensive plastic temporaries, either now with the printed ones or the old-fashioned dentures that screw in, instead of having to wear those that are prone to break for up to 10 months, our patients would have been enjoying custom zirconia teeth for months. And if you do your research, probably you would have saved $15,000 to $30,000 over these centers that only have the ability to make inexpensive plastic temporaries. So we always urge consumers to do your research. We find that a lot of centers are trying to pretend if they only have the ability to print simple temporaries like this, that somehow they have an advanced lab like our multi-million-dollar milling center. So the difference between the technology to fabricate this is you can buy a $5,000 printer, a $10,000 computer, versus to do this, you have to have, like we do, around 30 technicians, and we've made a multi-million-dollar investment. Don't get fooled.